we are going to bring in Dr. Duane Mezwa. He is the Dean for the Oakland University William Beaumont School of Medicine. Great to have you with us here, Doctor, on the Oakland County Megacast.
Good morning. Thanks for having me. Pleasure to be here.
You know, and I remember back when it was big news when they were even opening up the School of Medicine there at Oakland University. It wasn't that long ago.
No, it really wasn't. It's a little over 12 years ago that the concept began. And once we got the school started, we graduated our first class in 2015. We started with a class of 50 students and gradually increased to 75 to 100, and we're now at 125 students, and with a total class enrollment in the entire school of 500 students.
Wow. So do you think the pandemic is actually going to increase the interest for some of these students to go into the area of medicine?
I have no question that it does. If I just look at our own statistics now, again, we are a growing school, but this year we will hit over 8,000 applications for 125 seats in our school. So it's extremely competitive, and that's from coast to coast. And thinking about that, it's a big challenge for us to get through all of those applications and find the right 125 students to come join us in our community.
And on top of that, so you're trying to navigate that process of accepting these students, but on top of that, once they get into the classroom, how are you teaching these students in this world of COVID-19 and the crisis, because it's all virtual pretty much?
Yes, it is. But I also look at it as not only challenges, but they are opportunities. And I really think that when we look back on all the things that we did to get us through this pandemic, we're going to find that our school is a far better school today, and some of the unique things that we're now creating. We're very fortunate that the founding fathers of the school, Dean Bob Fulberg, who started as the founding dean, they started to record the lectures from the very beginning. So not like we had a crystal ball knowing that we would use these someday, but our library is pretty extensive. So if we want to look on a topic, we probably have 4 or 5 or 6 pre-recorded lectures on a specific topic. So when it came time for us back in February and March to have to switch over to all virtual, it really wasn't that difficult. So we had everything recorded in the past. We still give live lectures today in a recorded fashion so the students can hear them synchronously or asynchronously. So we've always had it available for our students to be able to go back and look at a lecture at their convenience. And if they may have missed a class or they missed concepts that they heard in class, they have the ability to go back and listen to not only that lecture, but previous lectures as well. So it's allowed us to do that. On the other hand, so that's the first 2 years. In the third and fourth years, we had to make some difficult decisions back in March as well. When there was a challenge of having enough personal protective equipment, the PPE, and the challenges that our volumes were shifting to more COVID patients versus routine sort of surgery and patients that we would see, we pulled our students off the clinical units for almost 6 to 8 weeks. We waited until we understood this disease a little bit better and had adequate PPE before we could put our students back in the units. But at the same time, we came up with novel ways of teaching. This offered us an opportunity to come up with a new elective in COVID and understanding pandemics and infectious disease, things that previous classes really didn't have because that experience didn't make itself available. So we were able to pull those things, and our professors responded very quickly to creating new opportunities for the students. You have to think about, okay, in the third and fourth years, we have surgery and emergency medicine and internal medicine. How do you examine a patient remotely? There's only so much you can do. So for each of those clinical rotations, we use the term, we deconstructed those rotations down to didactics and to ways that we could actually examine patients virtually. So I think it gave us, again, an opportunity to expand into the areas of telehealth. That wasn't such a large focus 2 or 3 years ago in our curriculum. I can never see us going back without it now going forward. So we've changed medicine. We've changed things we're going to include in our curriculum, all because the pandemic has offered those opportunities to us.
I do think there are a lot of positives coming out of this, but what about some of the students in internships? Because so many industries, so many companies aren't even allowing some of their employees back into a typical business setting. What does this mean in the world of internships for some of your students? Because that information and that experience can be so valuable for them and their future path in life.
Well, absolutely. And, we had to sit back and look at what were the most critical things that we had to make sure our students learned before we could call them doctor, before they graduate. We want to make sure that they're ready to enter their internships and their residencies. And we had a short timeline. If you remember, I think we were rather fortunate that the pandemic began when it did, because we only had 8 weeks left of class to really get through. Imagine now, as we're starting to see our numbers go back up again, we're having to reassess, are we getting back to where we were in February and March? So what this means for our current first and second year students, we have made the decision that there will be no face-to-face interaction till at least mid-March. So we're going to continue teaching everything remotely and do as many interactive sessions as we can remotely. So we even have still live lectures going on with interactions with the students, but it's going to continue to be a challenge. And we're going to try to do the same things in the clinics as we go forward. So we watch those volumes very carefully. The other thing that's happening that's unique to this year, as our fourth years are now getting ready to start choosing where they're going to go for their residencies, traditionally in the past, they ventured all over the country. They would get on an airplane, they would go for an interview, they would spend a day at the hospital, decide if this is a place where they wanted to train for the next 4, 5, 6 years. That opportunity is not there this year. So all of the fourth year students across the entire country are having to do this virtually. There's no going to visit. It's a challenge not only for the students, but it's also a challenge on the hospital side, because they don't get to see these students now individually and spend time with them to decide who's the best fit for their program. So this is actually ongoing right now through November, December, January. We have our students doing virtual interviews across the country. There are now coffee hours with residents on weekends. There are social interactions that happen the night before the traditional interview. And in order to get our students ready for all that, we actually had mock interviews. We've had sessions with them on mock social interactions to get them ready for the new way. Will it be like this next year? I'm not sure. We'll have to see. How are we going to handle this next year? Will we go back to the traditional, where somebody would go to 10 or 12 programs, spend a lot of money getting on airplanes and going around the country and taking a look at potential places where they want to train for their specialty? So this is very different for all of us. But again, the resilience and the adaptability of our students and programs and physicians and staff across the country is truly amazing.
Yeah, medical school is not easy. And you put on, like, I'm going back just to my, biology class where you had to dissect, a frog or a pig. There are some things that just need to be hands-on.
Right.
And do you worry that some of these students are not going to be prepared for that human interaction, hands-on approach, because they're going to be delayed because of this pandemic?
Well, I will tell you that's a great question, and one that we grappled with early on with anatomy. When I think back to when I went to Wayne State, 40 years ago, we spent a lot of time in the anatomy lab doing our dissections and learning relationships. And I can tell you that was some of the most important learning for me of all of medical school. I became a radiologist, and I used anatomy every day of my practice for the next 40 years. So it still stays with me today. How did we get around that today? COVID didn't allow us to put 4 students on a cadaver to be able to do their own dissection. We have a class of 125, and when we looked at our space, we found we were limited to less than 15 or 16 people that could be in the lab at a single time. We had to resort to asking our anatomists, our professors, to do prosecting. In other words, they went into the lab and did all that dissection for the students and getting it all ready for them to come in the next day. So this is perhaps not the same way that I learned, but it's the way that they're learning right now. So they are still seeing. We have excellent videotapes that we have available for them. So I'm convinced, at least in that area, they're going to be well prepared. We're not, like I said before, we're not going to have hands-on face-to-face till back into March of next year, but we're not eliminating anything. It's just going to be compressed into a shorter time frame. So we think we'll have them ready to go on to their internships.
Well, the good thing is technology is a little bit different today than what it was when we were in school. So that is the good thing that is coming out of all of this. Dr. Duane Mezwa with us here. He is the Dean of the Oakland University William Beaumont School of Medicine. Right now, with this new surge of COVID-19 hitting so many of our communities, I think the one thing that is coming out of this is it really is putting such an emphasis on our healthcare system and the need for people to go into this arena. Do you think that's going to continue post-pandemic?
There's no question. We spend a lot of time out in the community trying to make sure that folks are educated and know what medical school is all about. The interest is still very strong. I spend a lot of my time talking to students who are thinking about going into medical school. I spend a lot of time with some students who may not get into medical school the first time around, and how can we improve your application to actually get you into medical school. Spend a lot of time with our medical students in determining what they're going to do for their life career. What kind of doctor do you want to be? That's a challenge for all of our students because you change so many times throughout your entire medical school training. I know for me, I didn't decide I was going to be a radiologist until the first month of my last year. And I like so much of the different rotations. But yeah, we do spend a lot of time getting them ready. And I do think the interest is still very, very strong. And it really starts in that middle school level, high school level. We have several programs that we put together over the summer, and some of them had to be done virtually this year. But we do have a pipeline program. We get students interested from the community, especially from our Pontiac area, where we spend a lot of time in the community with students. We have our students going into high schools and middle schools and teaching and spending time with students, understanding what the science and technology and engineering and mathematics is all about, and getting them interested in the health sciences.
But with that, Doctor, one thing that even came out prior to the pandemic was the lack of diversity going into the healthcare industry, into medical schools, because the cost is astronomical. What's being done to kind of address that lack of diversity, to try to get some of these bright students to go into the healthcare industry?
You know, that's another great question, and one that's being addressed even at the national level by the AAMC, the Association of American Medical Colleges. It's a very sad fact. If you go back and look at where we were with underrepresented minorities 15 years ago to where we are today, we have not moved the needle very far. So our generation has not done a great job. And it's going to take us really getting down to that middle school level. Our pipeline programs are very important. But even if we do find the best and the brightest, and we are looking for students who come from families who are in need, it's part of our mission to get them into medical school. We need more money. We need more money for scholarships. I'm very proud to say that at least this year we held our tuition to no increase, and we increased our scholarship distribution by 20% this year. So our students are in definite need. People talk about the large salaries and incomes of doctors, but when you look at our students who finish, our average debt for our medical students coming out of OUWB is about $240,000. Mm-hmm. So before they even get out into practice, and that's before residency, so they'll have more debt when they get through their residencies. They have a mortgage before they even have a house. So it is a very, very difficult thing to handle, and that's why the scholarship dollars becomes very, very important.
So do you think that hopefully that conversation can be pushed to the forefront to address the issue?
Yeah.
And that could be the good thing coming out of this pandemic.
Yes, there's no question. But even without the pandemic, we need to fix this. I mean, it absolutely is broken and recognized across the country. We need to look at our traditional black colleges and try to get more of the students into our schools. And it's a concerted effort that we try to make, but we're limited by some of the laws in the state with how we actually admit our students. So that is a concern, but we do a holistic review and look at all aspects of our students, trying to increase that number.
Well, it seems like you still have a very competitive field of applicants trying to get into the school there at the William Beaumont School of Medicine at Oakland University. So the good thing out of this is we have some great people going into the world of medicine trying to fix our world. So, and they have great educators such as yourself with real life experience. So we want to thank you for being with us here on the Oakland County MegaCast, and thank you to your entire team over there at Oakland University.
Well, thank you very much. I appreciate being on. Thank you.